All right. Can you show me the screen real quick? Can everyone see my screen?
Yes.
All right. Um, Welcome everyone to Accessible Healthcare Careers, Navigating Disability in a Demanding Field. My name is Caroline Rogers, and before I pass it off to our moderator, Jessica Kim, I wanted to inform you all about an exciting opportunity happening on October 30th. On October 30th from 11:30 a.m. to 1:30 p.m., Duke Energy will be conducting a focus group led by their Do It Disability Outreach and Inclusion team in the Career Center classroom. It will be a great experience and opportunity to discuss accessibility in the workplace and learn more about how Duke Energy supports their employees. They will also be providing lunch. It is reservation only, so if you're interested, use the QR code or email me, croger91@charlotte.edu for more information. Now I'm going to pass it off to Jessica Kim, one of our assistant directors and the Healthcare Science and Research Industry Specialist at UNC Charlotte's Career Center.
Thank you, Caroline. Hello, everyone. I am Jessica at the Career Center, and I'm lucky to work with Caroline. I am also a double alum of UNC Charlotte, so I have a lot of Niner pride. But today we're focusing on these amazing female panelists that we have. And so I'm going to allow everyone to just say a little bit about themselves, where they work, what their position is, maybe a little bit about their passion. Yeah, we'll get started. So let's see. Sarah, you're at the top of my gallery view board, so go first, Sarah.
All right. I'm Sarah Schonkweiler. My visual description is I'm a middle-aged white woman wearing glasses, and I have my on again, off again, mostly off again hair wrapped up in a purple scarf today, which matches my Disability is Human sweatshirt. I'm super excited that I actually got that in the mail yesterday, and my Disability is Human, embracing the humanity in all of us flag that's on my wall. You're getting my actual office in the background because virtual backgrounds and scarves don't mix. And above my head is a quote that says, "Beauty is the first test. There is no permanent place in the world for ugly mathematics." The no ugly math is nice and large, so our tech team can see it because I'm an engineer who left the field after developing my disability against my will and made the switch into education. So I've taught calculus, chemistry, and physics over the years, and now I'm an instructional designer at Whiting School of Engineering at Johns Hopkins, which I love because I get to use both my engineering and education backgrounds. And I teach chemistry and physics to teachers at the School of Education with a big focus on STEM equity and disability. So I joined our Hopkins Disability ERG, Employee Resource Group, this year as a co-leader with Ro Bowman. So I think I'll pass things over to Ro and let her continue that story.
Thank you, Sarah. Yes, my name is Ro. I go by Ro. My pronouns are she or just my name, Ro. I am the founding co-chair of our Employees with Disabilities and Allies ERG. Um, you know, um, my visual description, I'm reluctant to say I'm a middle-aged white woman, approaching maybe. Um, fairly, fairly fair-skinned. I have jaw length red hair that does what it wants, in spite of what I tell it to do. I have blue eyes. I'm standing in front of a teal background with some lively, bright art. I was an emergency room nurse for 12 years. I worked weekend nights and absolutely loved it. And then when I was laying on the stretcher at 2 o'clock in the morning myself going, oh God, what now? Um, it's been a journey. And ended up founding our ERG because I kept reaching out going, so who's our disability advocate? And I kept getting the answer, you keep meaning to get one of those. Uh, so after about the third time, I was like, okay, fine, it's me. I'm starting it. It's now. This is what's happening. It's happened. I'm here. I'm gonna run it. So we've grown to about 130 members, and we were able to join forces over on the university side of Johns Hopkins with Sarah just a few months ago, and just thrilled to have such a dynamic co-leader, co-chair. So pass it to Jessica.
All right, and then I pass it to Monica.
Hi there, I'm Monica Albert still, and I am a nurse at UPMC Mercy's Adult Spina Bifida Clinic. I am an adult with spina bifida. This is the job that I wanted when I graduated from nursing school. Of course, there weren't any adult clinics then. It was all pediatrics, but this is what I wanted to do. And way back then, because I didn't do my visual description, and I apologize. I am a heavy set white woman with pinkish, purplish hair, and I am older than middle age, just the beginning, almost a senior citizen, but not quite there. And I became a nurse 1,000 years ago, it seems like. In any case, when I started in nursing school, what I was told was that I was too close to the subject matter of spina bifida, that I would not be able to be objective, which, considering I graduated nursing school in 1987, that's how they thought then. But I'm very fortunate that things have changed, and I hope they change more, because I firmly believe that people can be a nurse with the right accommodations. It's not just moving patients. It is there's so many different parts of nursing and so many things that you can do with it. So I want to encourage anyone who feels the passion to become a nurse to become one. And I will give it back to Kim.
Okay,
To Jessica,
awesome.
sorry.
All right, thank you. Caroline, I'm just checking in. Kai, you haven't heard anything yet?
I've not heard anything. I sent her a message letting
Okay.
her know that we've started and to just join and introduce herself when she.
Okay. Sounds good. So we'll just get started. We're just gonna start with some questions and let the audience get to know the panelists. And then we do have the chat that Caroline will be managing. So please put any questions on your in the chat. And if you have any questions while we're going through the list of questions, you can raise your hand. All right, so the first question I have for you all, and anybody can jump in to answer this question, is what do you think are the most significant systemic barriers that prevent healthcare workers with disabilities from entering, advancing, and thriving in the medical field?
I can answer that. The ableism in medicine. That is the biggest barrier to people with disabilities. Nursing school has changed, but not all that much since I went to nursing school. That it is often seen that people with disabilities are not capable of being doctors, being nurses, being any kind of clinician, or that they suggest that social work is a wonderful profession, but they suggest that you go into social work, or they suggest that you become an administrative assistant. But the thing is if your passion is healthcare and you wish to care for people, that's where you should go. And that is one of the bigger barriers there is. Even where I work in a brand new building, and it was designed by disabled people having input so that the Rehab Institute has great accommodations for people who are patients, but they totally forgot that staff also are wheelchair users. So we play a lot of wheelchair bumper cars in different rooms. But
All right, Ro, you had your hand up.
Yeah, I was gonna agree with Monica. What is the biggest barrier? Mindset. Mindset is the biggest barrier for disability inclusion in healthcare professions. You know, so much of medical school too, you know, I've worked at several different hospitals that have all had residencies, and I've worked with residents, and I've seen, you know, the evolution, and it's just an absolute meat grinder that they put doctors through to put students through to become doctors. And I really think they are missing so much potential in so many other wonderful people who would make great doctors if that process just wasn't such a crucible that it is. And so I really think mindset is the biggest barrier in healthcare for disability employment.
And I was just going to add one quick thing. I put the links in the chat to a workshop I'm doing next week with one of my blind students, and an article that I wrote about her in our engineering magazine. She was our speaker for Disability Pride Month at JHU, because one of her faculty members told her that being blind was a liability in nursing and she should just drop out now because she was never going to get a job. And since she was scraping together all of her pennies to be in nursing school, that's what she ended up doing. So she was in Dayton, Ohio at the time. She's one of my former students because I had her as a high schooler. And at the time, she was paralyzed with Guillain-Barré. And so when we were working together, she was using a wheelchair. And so it's odd to now actually be both back in Maryland, and she's walking after years of physical therapy and being able to do that, and lost her vision due to brain swelling from surgery. So for her to be told to drop out of nursing school, I'm not buying that. So Ro and a lot of the other nurses in our ERG were talking to Eiley at our meeting and telling her why she should not believe that. And the Ohio Department of Rehab told her the only job she could do as a blind person who might have a seizure is to be in the hotel laundry, which we just cannot even figure out. Uh,
All right, and we do have our fourth panelist, Kai. She's here. So Kai, would you mind introducing yourself?
Hi, good morning, everyone. Sorry for being late. I'm having technical difficulties trying to turn on my camera and everything, but it should be on shortly. So my name is Kai. I currently am working for a global financial institution, and I also have my own company. Introducing myself. Wow, okay. So I have a disability. Yeah, I have relapsing remitting MS. And with MS, I, lost all the feelings within my entire body, my hands, my legs, my eyes, sometimes internal organs. And it's something that I'm dealing with, but I have found my faith and I have found my strength, and I'm hoping that I can contribute as best as I can to this forum.
Awesome. Thank you. Thank you so much, Kai. It's nice to meet you. And we did just go off that first question. I didn't know if you wanted to comment, but the question was, what do you think are the most significant systemic barriers that prevent healthcare workers with disabilities from entering, advancing, and thriving in the medical field? And if you wanted to comment, that's fine. If not, we can move on.
No, I'll comment.
Okay.
So the systemic barriers in healthcare, they mirror those in tech and finance, which I have experience working in. There are outdated policies, limited digital accessibility, and I would even say there's bias in hiring. For professionals like myself with disabilities, it's not like a lack of skill, it's more like a structural imagination. And we need universal design in accessibility designs baked into workforce strategy. And it's not added as accommodations after the fact when they realize that we do need these sorts of things.
All right. Thank you, Kai. We're going to move on to the next question. The next question is, beyond legal compliance, what ethical obligations does your organization prioritize regarding accessibility?
Um, could I, so I think we all as providers and clinicians have a ethical responsibility to look at our unconscious bias. And I know that our executive member who supports the ERG, Dr. Rick Verdette, he had done unconscious bias training himself, and it had discovered that he had a fairly strong unconscious bias against people with disability. And he decided to confront that head on and become an active supporter of the, the Employees with Disabilities and Allies ERG. Um, it's there's so much beyond legal compliance, that as providers, you really have to morally see, am I giving this patient the best care, the right care? Am I actually meeting them where they are and their needs? Or am I being paternalistic or, judging through this medical model of disability, that discounts their experience, and life? So, examining your unconscious bias, and seeing the world from your patient's view, I think would be huge.
Monica, I see you have your hand up.
Yep. I work at UPMC, and what they have is a disability resource office. And the disability resource office is not just for patients, but it is also for employees with disabilities as well. On the patient side, what they do is that if there's something that you need to tell your doctor or need to make sure that a floor knows, or that you're coming in for a test, something that they know what accommodation you need, you tell them, and they talk to the floor and they talk to the doctors, they talk to the clinicians, and let them know what your needs are. And it works the same way. It's very much a culture of inclusion. Not we're supposed to use that word anymore, but that it is recognizing where people are and what their needs are. And they do that for the patients and also for the staff, which usually it works out well and makes for a much better working environment.
All right. Thank you so much for providing some feedback on that. Let's see. Let's jump to another question here. What measures are in place to ensure that healthcare professionals with disabilities have equal opportunities for career advancement and leadership roles? I know that's a popular topic with students when they are networking with employers. They want to know, can I advance in my career in this position? Is there upward mobility? Also, is the organization supportive if I wanted to advance in my career with education, professional development, all those kinds of things? It is a well brought up topic among students.
I'd like to answer that one.
Okay.
So I am currently working in AI. I am an AI governance analyst for the company that I work for, and for my company, I'm the director. I will also say that I have absolutely no experience in this field. As a student, or I'm not a student anymore, but when I was a student, I didn't think that these opportunities were available to me. So I went through and I did my degree in engineering, and it was so hard. I nearly died like 3 times, was in the hospital all the time because I was just pressuring myself, pressuring myself, pressuring myself. But at the end of the day, I'm in this position that is highly sought after in my country. And I only got it because I did online courses. So if there is someone within my position with a disability or disabilities that needs to advance in their career field, and it seems kind of daunting, I would say use what you have. I only had free courses online. I did a lot of them. I have like 40 under my belt. And I did a lot of them. I had no other choice but to. I couldn't move, go anywhere. So, just doing the courses, did them, and suddenly I'm being offered positions and people are trusting my insights and my input. So use what you have and develop from there. It's not only education that employers nowadays look on, it's also who you are as a person, your character, your mindset. Just keep engaging, keep being positive, and never stop trying.
Thank you, Kai. That's very motivational. I like the inspiration you're giving everybody. And Ro, you had your hand up?
I did. I think Kai probably has a better answer than I have. Because I would say what measures are in place to ensure professionals with disabilities have equal opportunities for career advancement. There's the Office of Institutional Equity, which you can file a complaint with, but that's a reactive measure. There's not a proactive measure that I'm aware of. We have our ERG, we support each other, on a peer-to-peer level, but institutionally, I would say there's significant opportunities for improvement in that area.
Yeah, I would agree with you, Ro. And I noticed that after Kai was talking that Sarah and Kai you both have engineering backgrounds, which I thought was very similar. And now so you're in a totally different space. Well, Sarah, you're still working in the STEM area, teaching in the STEM area and teaching in the engineering department. But Kai, you're working with AI and tech. And so, um, so that we tell students all the time, like major does not equal career. And just because you majored in business or engineering does not mean that you're going to do that for the rest of your life. But I would say just listening from what you've gone through in life, you just followed the path that was in front of you and, followed your passions. And that's led you to where you are now, correct? Yeah, Sarah, you have your hand up.
Yeah, I was just going to say, I never expected to be using my engineering background, like 20 years in engineering and then 20 years in education, to be designing engineering courses. I knew when I accepted this job, and I was pretty sick at the time. It was my own instructional designer that convinced my boss to give me a chance, I think, and convinced me to give my boss a chance. And she's been amazing. But yeah, I didn't go public as having a disability until about 2 years ago, when another engineering professor told me that I should consider owning my disability story to be a role model for students with disabilities. She said, as a successful engineer and now as an educator, the students need to see that we're here too. And I was hiding my disability for a long time. That's why we were joking earlier about t-shirts from Fierce and Fearless on Etsy, and students were wearing shirts that said disabled is not a bad word. So the one that I picked up says, disabled is not a bad word. Trust me, I know all of them. And usually in workshops, I say ableism, bias, craptions, but when my student in nursing was told to drop out, I've probably used some other ones.
I think on a kind of on a minor scale, just from hearing your stories already and just looking at everyone's LinkedIn profiles, very impressive. Everyone has impressive backgrounds. And I think what you all do currently, you have leadership roles, you're publishing. Sarah, I think I saw your recent post of like you're publishing things. And in a way, for me, I see that as you are serving as role models for people. You are in leadership roles yourself. And so you're showing that your organization is supporting that. And so I think that is super motivational, super inspiring for others, students that are here today, seeing that, you all have also said that this is my personal story. This is my disability. And that makes you even more passionate about the work you do. And so that is a super driving force that I see, that there is career advancement for people with disabilities, seeing what you all do today. All right. So another question that I have for the panel, anyone can jump in. What is your organization's formal confidential process for requesting a disability related workplace accommodation? And how is the process adapted for disabilities that are not immediately visible or that fluctuate over time? Oh, okay. Monica, I see your hand, and then Kai. Oh, Monica, mute.
I knew
I
I was
always
going to do
forget.
that. It's interesting because the accommodations, the process here is not any different for anybody, whether you have visible or an invisible disability. That it is going through, it's a big organization, you go through HR, it is confidential, and it is addressed that it is just you get the documentation that they need just from the physician, your physician, and it works rather simply, which I was surprised at because in the past I have not worked for places that are that are as open with with the process and with it's all right. And fluctuation, that's always what's hard because that I cannot tell you what I might need today may not change tomorrow. But the good thing is that they do respond quickly. And the way that they respond quickly is when I have in the past said, I need to work from home some days because of some issues going on. They're all right with that. And that's the nature of my job, that I'm able to do that.
Hi.
Okay, so when I initially left university, I had the blessing of being offered five jobs in engineering. And as I told you guys initially, when I did engineering, I nearly died like 3 times. But I was offered a good amount of jobs, and I decided to go with one that was nearest to where I lived because of my disability. And initially, when I went to work there, it was awful, especially as someone with an invisible disability. I am someone who's also pretty fit because I take care of myself. So when they saw me and I would complain about, I'm extremely fatigued today, I'm experiencing chronic fatigue, or my hands really are not in the best position to do that or do anything or walk. It was hard for me to walk. They would judge because as a institution, they are used to seeing visible disabilities. And that's not wrong. That's okay. I walked the halls within the company and I saw people in wheelchairs or an amputee, someone with an eye patch. I saw all of that. But when it came to understanding my situation, I literally had to prove that I was sick. And living in Jamaica, it was expensive to prove. And coming from university, I didn't have that kind of money. So I would say that I had to learn through how many companies? I've worked a lot of places. So I had to learn through 7 different companies to go for where I felt comfortable, regardless of how much they were paying me. So first it was engineering companies, and I was like, okay, it has to be good pay because I'm an engineer. No, it didn't matter. I needed more experience. Couldn't get the experience because I was sick. Then I was like, okay, I'm gonna go for remote companies because they would at least list, I wouldn't have to explain my situation to them as much. But not all remote companies are able to handle someone who needs a bit more time off than other people. So then I had to venture into asynchronous companies. You see the trajectory I'm trying to detail here? You have to find something for you. And it's not going to be easy. It is going to be extremely difficult. And you are going to cry a lot. You are going to wonder why a lot. You didn't ask for this disability. You didn't ask for these issues. You didn't ask to be unable to do certain things. And because you do not look sick, people are going to make their judgments about you. So you have to do what is best for you, and you are going to disappoint people. You are going to make people upset, but you also have to take care of yourself. You are the only person that you are going to live with for the entirety of your life. Who cares what anybody else thinks? I mean, that's kind of subjective, but just take care of yourself at the end of the day, because you don't need to run yourself into the floor for a company, genuinely. I hope that answered a bit of the question.
Yeah, a lot of trial and error and testing the waters, but also you sound it makes you really tough and
Yeah.
also an advocate for yourself. And so yeah, I like that brutally honest answer. So thank you, Kai. And Ro, you had your hand up?
I did. I know Sarah put in the chat a little bit. Getting an accommodation is not an easy, straightforward path. It is dark, it's convoluted. Like Kai said, you're gonna cry. You're gonna cry at several points along the way. I think a lot of companies hear accommodation and think money. Oh dear God, what is this gonna cost me? And one of the, presentations I'm happy to give is just about how little accommodations actually cost a company, how much they receive the reward for it in many ways. Financially beneficial to the company. But with that accommodation process, I've been through it several times for different aspects. And for my physical disability, I had to get my surgeon to write that I got to pick out my own chair and I got to pick out my own desk. And that took months of back and forth and judgment and everything. And because of the location, I had to go to the vendor that they used, right, to Goldilocks all of their chairs and decide. Now, what really frustrates me so much is I see my coworkers who don't have a disability, but their desk chair still hurts them. They still are like folding themselves into a desk that isn't great. And I'm like, I just wish everybody had the opportunity to have their work environment not physically hurt them to be in. But it's so challenging when so many of these institutions, just with all of this entrenched paperwork rigmarole that you have to go through, that it really is very challenging to get an accommodation approved, especially if it might actually cost them money. One accommodation I got approved that didn't cost them money was one of the units I worked on. They had several set scheduled tracks. One of those scheduled tracks ended up giving me a migraine every single time. So, I could work on schedule track 1, 2, and 3, and 6, 7, and just like not this one. And that was a no-cost accommodation. And that's the type of accommodations I think employers rather, they don't think of, they don't consider, they don't talk about. I can put a note in the chat, but the job accommodation, job accessibility network, they're really good at being able to look at your disability, and they have suggested accommodations that you can request. Because sometimes you don't even know what you need. It's really overwhelming. So thank you for my really long-winded answer.
No, thank you, Ro. And I did put that link in the chat for you, Ro. So that is a great website, Job Accommodation Network. A lot of really great information. So please look into that. Yeah, my next question actually goes into what you just spoke about, accommodations. It's talking about fostering an inclusive culture. So how does your organization, or maybe an organization that you worked for in the past, do they foster a culture where employees feel safe and empowered to disclose a disability and request accommodations without fear of stigma? And what resources are provided to support their well-being and success beyond legal requirements?
That is a big question. I will say one of the supports that happened, there was a disability task force that was formed. We were able to create a My Learning, which is our annual training education that everyone has to do. And we were able to create one specifically about disability, specifically about invisible disabilities. And, you know, just because someone uses a wheelchair some days and a cane some days doesn't mean they're not faking it. Like, disability exists on a continuum, and you have bad mobility days. You occasionally have a good mobility day, and that's awesome. But it's not ever that someone's making things up. And that was one of the points that I think we really tried to get across in our My Learning. And Sarah was involved in that process as well. So I'm going to stop and let Sarah talk for a moment.
Go, Sarah.
So I was just going to put in the chat that, yeah, that's actually how Ro and I met, because in the engineering school, we had developed a training for faculty. No, let me back up on that for a second. My first job as an instructional designer in the engineering school was to develop a course for faculty on accommodations, with the just tell faculty to do it mentality. And so I worked with Student Disability Services, and our take on that was, if we don't include why, and we don't include the proactive accessibility piece in that, then we're always retrofitting, we're always having to accommodate. So we did include the important background information on disability. And quite a few faculty members came to me later and said, I didn't realize I qualified as disabled. And I'm like, me either, like with chronic illness. And I've shared my story on my LinkedIn, but as Rose said, I was invited to be on that working group also because of a interview I did with the wonderful Dr. Stephanie Van on this ability clinic, not disability clinic. And anybody who's a student in medicine should definitely look that up. We'll put the link in the chat. But it was rolled out to 60,000 employees at Hopkins Medical as part of their required training. So we consider that a really big win. And I was invited to be a speaker at the Center for Staff Life Design launch event on the university side. And because of their disability lack of accommodations, I haven't been allowed to travel or go on site at the university at all. So I told them, thank you for inviting me, but I can't be there. And so they got me a Zoom link like immediately. And so I was the only person on Zoom for this with my head on a table, on a TV on a table. And I said at the end of my talk, it was about the roses and thorns of being an employee. So I told my disability story and said, I debate every day whether or not it's safe to say I have a disability in my job. And a couple people from HR did hear that. And so, we're working to make the accommodations process better. We're hoping to make it more clear, because I had a terrible time trying to follow it myself when I was recently sort of pushed into getting accommodations. So we're working on it.
Yeah, and I think when people do Ro, Kai, Monica, everyone, when you're doing these things and it's tough for you, the next person behind you, it's a little bit easier for them because you've cried and done all this hard work and you're doing it for the generations behind you. So that's very, inspiring, and I think you're doing an amazing job. So Kai, you had your hand up?
Yeah, I'll just try to be short. When I was, as I said, I worked at many different companies, so I had a lot of different experiences. One of the last companies I worked for, they did a seminar, and it wasn't geared towards disabilities, and I don't think they were trying to tackle disabilities, but they spoke on intent and impact. meaning how you intend for something to come across is not how it's actually impacted by the other person, because you do not know what the other person is going through. You don't know their situation. So at most, just try to be professional and try to be kind. You know, being kind is not so hard. That's what they started out with. Then they continued and said, kindness is hard though, because we don't know what people are going through. And we are saying something that sounds kind from our mouths, but when someone else hears it, it sounds like we're judging them because of some past indifferences that they had already experienced. And it's hard for us to really gauge what someone is going through. So at most, just try to be professional, especially in a working environment. I say that to say, when I experienced ableism from that same company that gave that seminar, when I literally could not walk and I literally was having trouble keeping up and they let me go, I decided that I'm going to start a newsletter and informing people that not everybody that you see in a wheelchair is unable to use their brains, and not everyone that you see walking is unable to like think all the time. We are not consistent individuals. This is to say, however, that disability, either through age or illness, comes to everyone. That's unfortunate, but that is life. It comes to everyone. And we as a society need to make, if we started from ground zero, and ground zero being the unabled individuals, society as a whole will develop, because we genuinely don't know what is going to happen. And we don't need to live in this fear, but we also need to be prepared and be kind. Just be kind to people. It's not hard. So yeah, that's mostly what I went through and what needs to happen. So I started the newsletter. I started talking on how, collecting more data from people who are in disabled positions and learning from them could also help to push forward society. I did a paper on it. I made a newsletter. I tried to do a lot of things. If you are not experiencing how you want to be treated, go out into the world and make that experience for yourself, make that community for yourself, do what you need to do to get it across.
Yes, I agree with you, Kai. Disability affects everyone. And then also, I think you're doing great because you're putting the information out there. And I think a lot of it is uh, people aren't aware and they don't seek out that information. So, yes, I agree with you. And Monica, you have your hand up.
Remember to unmute. I just wanted to say that my journey to where I am now, I'm working in a space that I am very privileged to work in, and it took me, I'm 2 years, I've been a nurse for 38 years, and I got this position about 3 years ago. So it took me 35 years to get into a position, into a space that I felt accepted, that I felt safe disclosing my disability. And I'm just going to be brutally honest, it is not necessarily all about the company. It is about the physician that I work for. I work with 3 other adults with spina bifida. The physician that I work for made it a point of hiring people with spina bifida to work in the adult clinic. Through the years, what you have to be prepared to do is to, of course, educate yourself, get every kind of education that you can, and to increase your skills, because the more skills you have, especially in nursing, the more farther you can go on. The other thing is that I've looked at my career over the years. I started as a floor nurse in pediatrics, and I knew at age 20 that physically this was not what I could do for the rest of my life. And from that point on, I went into home healthcare, which I loved. And even with home healthcare, as my mobility became worse, my spina bifida was invisible in the beginning and then was not. And as my mobility became more difficult, I ended up getting more education, getting involved in different things, and moving up the corporate structure and becoming an administrator of a home care agency, because that's what I needed to do to accommodate myself it's not just about accommodations from the employer, but what you know you need to do in the long term. And through the way, I have sued employers for discrimination. I have had a person who is in charge of the EEOC tell me that I shouldn't have disclosed my disability. I have been in hostile work environments, and I am just very fortunate that I'm 60, so I guess it's at the end of my career, that I found a space that I'm comfortable with and that I'm very happy to be in. And it took time and it took perseverance. And I didn't want people to get the impression that I was in a perfect world, because I am far from it. Where I am now is so much better. And I also think it is the change of time, that there are some places that are different now. Not a lot. The last job I had prior to coming here, I had an accident at work. It was very embarrassing. I didn't make it to the bathroom in time. And my employer called 911 and in front of people had me discuss my health and wanted me to write down exactly that I would never have, I'll be blunt, explosive diarrhea again. I'm like, nobody can do that. How can I do that? And so it has been a rough road, but it's been worth it. And because this is my passion and this is what I want to do. I've always known I wanted to be a nurse. I was 4 when I figured that out. So
I
I just
saw,
wanted to encourage people.
yeah, I saw on your LinkedIn profile, your headline said, I think it said, I have the dream job that I've wanted ever since I was a kid. That is your headline. So yes, you do have yes, and I think the stories that you all are sharing, it's not been an easy road for you all. But and you said that you might cry and students might cry, but coming here to this session, now they have this connection with you all. And I encourage all of you attendees to connect with these amazing women on LinkedIn and say that, hey, I attended your panel and I heard your story and I want to share my story, and you can connect and, kind of help each other. So this is why we do these events. So you have these connections. This is all networking. So, yeah, love these stories. Caroline, do we have time for one more, or do you want to move to any questions?
I've not seen any questions in the chat as of now.
Okay.
If anyone would like to put questions in the chat, they can go ahead, but for now, we could do one more question.
Sure. And this question kind of goes on to measuring success and accountability. So, how does your organization measure the effectiveness of its accessibility policies and training programs? And what specific metrics or feedback mechanisms are used to track progress and ensure accountability? All right, Kai, you have your hand up.
So again, I work in AI. So I love working in AI, and I would encourage anybody else to work in AI. Work in AI, guys, it's fun and it pays a lot of money, and they are nice to us. The idea of that is that when they measure our success and our metrics, they're literally measuring how we are further improving the institution that we have been involved with. And well, I will give a story because it just happened. This is last week, and I created an automation, and how that improved the company was that it allowed for people to be compliant, but it allowed for it to be easier for them to be compliant. So they were obeying the law, but they were easier obeying the law. They could do it easily. And how they measured my success is that, oh, it worked. So it wasn't that I was doing 10, then 20, then 30, then 40, improving based off of that. I was just from 0 to 100. It was either not improve or improve. And that was how they measured my metrics. That was my employee report. And I don't think that helps anybody, but I, I hope you guys jump into AI.
AI is a very hot topic right now, Kai. So I think, yes, that's good advice. All right. Ro, you have your hand up?
Yeah. Um, I wanted to say I'm not aware of any actively analyzing committee who I'm not aware of anyone who actively analyzes, okay, are our metrics improving? Do people feel, more easy to access their workspace? Or I feel as though it's most likely how many complaints do we get? And did we decrease the number of complaints rather than, are we actively proactively asking people about their experience? I know I know we do like climate surveys every year essentially, but I don't think disability has ever been like a topic in it. And Monica, I wanted to say I am so sorry that happened to you at your last employer. That is horrific. Um, I had someone scream in my face that they didn't have to make any accommodations for my disability, and if I had a hard time accepting that, I should get into therapy. Was already in therapy. Uh, but you know, it's reactionary, I think. And I think a lot of companies could really improve themselves by actively seeking out that information, and attempting to make themselves more welcoming for people with disabilities. Like Sarah said, it's still a very like, do I disclose about having a disability? It's a very emotional topic that's just fraught with 6 different kinds of peril that you've never thought would be a hard thing. I think as a nurse we tend to be really accepting of everybody, and so it comes as a real shock when someone isn't accepting back to me. And I just would encourage companies to, we have the ERG, we support each other, but that's not our day job. I hope that answered.
Yeah, and I just wanted to say that's one way that we encourage students to look at research employers. If they have an ERG for disability, they are more likely to be accommodating and more likely to be understanding versus an employer that does not have that. So students ask that all the time, like, how do I disclose, especially when they don't have a favorable or, for example, a student had a mental health disability, and they didn't want to disclose because it had a negative connotation to it, and they didn't want the employer to think of them negatively because of this disclosure. But what I can encourage students to do is look at their ERGs and see what they're posting on LinkedIn. What are they doing in the community? That kind of thing. So, Sarah, you had your hand raised?
Yeah, I just wanted to say, in way of encouragement, we still have so far to go. But I mean, one of the books I really appreciated is The Canary Code. Ludmilla was one of our speakers for our disability ERG. It's the subtitle is A Guide to Neurodiversity, Dignity, and Intersectional Belonging at Work. One of the just sentences that jumped out at me in here is that a few people who care can change the culture of an organization. And I know that's hard, but I will say it has been what prompted me to become a co-leader in the ERG. And I had to ask, am I allowed to do this? Can my bosses stop me from being a co-leader in the ERG? I'm determined that we will change the future. A few of my faculty in space systems engineering and I decided to start presenting at workshops and conferences, and we've done like 60 interviews, articles. Rose said I'm a prolific author. It's just because I'm tired of it. And my faculty have been 100% behind me in going public as disabled. So there's a thriving disabled community on LinkedIn. Build out your profile, connect with us. It's a good place to meet people who believe in you.
All right, Ro,
Sorry,
you're going to be
I
our
just
last
took a second.
comment.
I know. So when you say they're worried about negative connotations, etc., you do not have to tell your employer what your disability is. You don't have to. Um, you don't even have to tell them that you're going to get an accommodation. That's a conversation between you and occupational health. And at least everywhere that I've worked, it's you and occupational health. Occupational health interfaces with HR. HR tells your boss this is the accommodation that has been approved. In my experience, that is how that goes, because you should not ever have to disclose you and violate your own privacy. No. So before anyone was like, I need to tell my boss that I have depression, like, no, you don't. You don't have to. Occupational health.
And then that website is very helpful as well. It has a lot of information. Well, it is 1 o'clock and this hour flew by, and I just wanted to say thank you so much. Monica had to leave because she had to use that room for something. So she did say goodbye, and so we thank Monica. Thank you, Kai. Thank you, Sarah. Thank you, Ro. You shared some really inspirational stories, and thank you for being so vulnerable and open. And students, please connect with them on LinkedIn and continue, discussions around this. Like they said, it's all about awareness and being there for each other. So thank you everyone for attending.
Thank you, everyone.
Thank you
Thank
for having
you.
us. Thank you.
Bye.